ready to dive into a topic that I'm sure every veterinary specialist out there is super familiar with. Diarrhea in dogs and cats.
Oh, yeah.
But we're not talking about just any diarrhea.
Right.
We're going deep on chronic cases.
Yeah.
The kind that makes you want to pull your hair out sometimes.
Absolutely.
And to guide us through this, you've shared a chapter from Clinical Reasoning in Small Animal Practice.
Yeah, it's a good one.
Yeah.
Really gets into the nitty-gritty.
Yeah, I'm really excited to dig in. And I think one of the things that really stood out to me right off the bat is how much it emphasizes the importance of distinguishing between small and large bowel diarrhea.
Yeah, for sure.
Like that's really the first step in kind of targeting your investigation.
Right, absolutely. It's amazing how much we can actually tell just by looking at the, character of the diarrhea itself.
Yep, totally.
Yeah.
And the book actually has this really helpful table 3.1.
Yeah.
That summarizes all the key differences.
It's a good one.
Yeah, and it really highlights how things like the presence of blood or mucus, whether the pet is straining to defecate, or even just the volume and the frequency of the diarrhea can give you clues about where the problem's coming from.
For sure, yeah. Like if you see fresh blood, for instance, that's a pretty good indicator that you're dealing with a large bowel issue. Whereas if you see a really large volume of watery stool, that often points more toward the small bowel.
Right, and then there's tenesmus.
Yes.
Which is that constant straining, and that almost always means we're looking at the large bowel.
Exactly, yeah. It's like having a roadmap to guide your investigation right from the start.
Exactly. It helps you narrow down the possibilities right away.
Oh.
So, okay, we've got a handle on the type of diarrhea.
Okay.
Now, the chapter digs into another key distinction, which is primary versus secondary GI disease. Can you remind us about what that means?
Yeah, so primary GI disease means that the problem originates in the gastrointestinal tract itself. Whereas secondary GI disease means that the diarrhea is actually caused by a problem somewhere else in the body.
So it's like a systemic issue that's manifesting as diarrhea.
Exactly, yeah. Like you could have a dog with liver disease or hyperthyroidism.
Right.
And that could actually be the root cause of their diarrhea, even though their gut itself is fine.
And that's where things can get really tricky because you have to rule out those systemic problems before you can even start focusing on the gut.
Exactly.
But there is one helpful tip in the chapter. It says that large bowel diarrhea is almost always primary.
Right.
So that at least simplifies things a little bit.
Yes, definitely. If you're dealing with large bowel diarrhea, you can usually focus your investigation on the large bowel itself.
So that's good news. All right, now the chapter really goes all in on the potential causes of chronic diarrhea.
Oh, yeah.
There are like 3 tables packed with information. Tables 3.2, 3.3, and 3.4. It's amazing. They cover everything from dietary sensitivities to parasites, infections, inflammatory diseases, even some really weird stuff.
Yeah, it's a lot to take in, but it's all incredibly valuable information, especially for veterinary specialists who are dealing with these cases day in and day out.
Totally. And while we obviously can't go through every single item on those lists,
Right.
I think it would be helpful to highlight some of the most common and interesting causes that we encounter in practice.
Definitely, yeah.
So let's start with dietary sensitivities. I feel like that's something we're seeing more and more of these days, both in dogs and cats.
Absolutely. It's becoming increasingly recognized. And what's interesting is that Table 3.3 actually distinguishes between food intolerance and true food allergy.
Oh, that's a good point, yeah. I find myself explaining that difference to pet owners all the time.
Me too.
So can you just break that down for us quickly?
Yeah, sure. So food intolerance is basically a non-immunological reaction to something in the diet.
Okay.
It often causes GI upset, but it doesn't involve the immune system.
Got it.
Whereas a true food allergy actually triggers a full-blown immune response.
And that can lead to way more severe symptoms, right?
Exactly, yeah. A dog with a food intolerance might just get a little gassy or have some loose stools after eating a certain food.
Right.
But a dog with a true food allergy could have anything from skin problems to vomiting to really severe diarrhea.
Oh, wow. And how do you figure out which one it is?
It can be tricky, yeah. It often involves doing elimination diets and carefully observing the pet's response.
Okay, so that's dietary sensitivities. Now let's move on to those pesky parasites and protozoa.
All right.
Tables 3.2 and 3.3 list a whole bunch of culprits. But are there any that you find particularly challenging to deal with?
Oh, Giardia is a classic one.
Giardia,
It's
yeah.
a protozoan parasite that can be really tough to diagnose because it's shed intermittently in the feces.
So even if a fecal test comes back negative, you can't completely rule it out.
Exactly. And the symptoms can be pretty vague, too. Chronic diarrhea, maybe some weight loss, sometimes vomiting. It can really mimic other conditions.
Ugh, so frustrating. Okay, and then there's Table 3.2, which has a whole section dedicated to hemorrhagic gastroenteritis, or HGE.
Oh, yeah, HGE.
What makes this condition so unique and challenging?
Well, it's this really acute, often dramatic syndrome characterized by bloody diarrhea and a super high-packed cell volume.
Okay.
And it can be really scary because these dogs can get so sick so fast.
Wow. And I think what's so fascinating about HGE is that we still don't really know what causes it.
Right. The chapter mentions the possible role of Clostridium perfringens, but they also acknowledge that we need more research to fully understand what's going on.
Yeah, it's like this big mystery.
And the treatment usually involves supportive care, like IV fluids and antibiotics,
Right.
even though we don't always know exactly what bacteria we're targeting.
It's like solving a puzzle where we're missing a few pieces.
Exactly.
All right, so we talked about dietary sensitivities, parasites, even this mysterious HGE,
Right.
but there's still so much more to uncover in this chapter.
One thing that always gets me thinking when I read this chapter is the part about inflammatory bowel disease.
IBD.
IBD, yeah.
It's such a common diagnosis,
Yeah.
especially when we're talking about chronic diarrhea.
It is.
But it's also one of the most challenging to manage,
That's
right?
it.
And I really appreciate how this chapter doesn't just present IBD as this simple diagnosis.
Right.
It really delves into the complexities and the nuances,
Right. For sure.
which I think is so important for veterinary specialists like us.
Yeah. Table 3.4 goes into detail about the different types of IBD.
Right.
Like lymphocytic, plasmacytic enteritis, eosinophilic gastroenteritis,
Right.
granulomatous enteritis.
Yeah.
And each of those presents its own unique challenges.
Totally.
Yeah.
And even within those categories, there can be so much variation in terms of severity
Right.
and how they respond to treatment.
For sure.
It's not a one-size-fits-all situation at all.
No, definitely not.
And I think the chapter does a good job of highlighting that.
Yeah.
They emphasize the importance of ruling out other causes before you just jump to a diagnosis of IBD,
Absolutely.
which makes sense because, like we were talking about earlier,
Yeah.
dietary sensitivities, parasites, even systemic diseases can all mimic the symptoms of IBD. So
Exactly.
you really have to be thorough.
Right.
And that's where those 11 diagnostic steps outlined in the chapter come in.
Yeah.
It's like a roadmap
Right.
for systematically ruling out all those different possibilities.
Exactly.
So let's walk through those steps a little bit.
Okay.
It all starts with the basics, right?
Yeah.
Thorough history,
Mm-hmm.
physical exam,
Yeah.
fecal analysis.
Oh, yeah. You got to gather as much information as you can about the pet's diet, lifestyle, any previous medical issues.
Yeah.
And of course, you want to look for any telltale signs of parasites or infections in that fecal sample.
And then the chapter recommends considering a trial of deworming medication,
Yeah.
even if the fecal test is negative.
Which makes sense because sometimes those parasites can be really hard to catch.
Right.
They might not show up on every test.
And they specifically mentioned whipworms,
Whipworms, yeah.
which can be tough to get rid of.
They can be.
And the chapter actually recommends that if you do find whipworms,
Yeah.
you should deworm every 2 months indefinitely,
Interesting.
which is a good point.
Oh, yeah.
It's not just about treating the initial infection.
Right.
It's about preventing reinfection.
For sure.
Okay, so next up is a trial of metronidazole,
Metronidazole, yeah.
which is an antibiotic that can be helpful for a variety of GI issues.
Right. It has anti-inflammatory properties, and it can also target certain bacteria that might be contributing to the diarrhea.
Okay, good to know.
Yeah.
And then the chapter suggests evaluating for secondary GI diseases.
Yes.
So this is where we have to think about those systemic issues that could be manifesting as diarrhea,
Exactly.
like hyperthyroidism, hypoadrenocorticism,
a liver disease.
liver disease, yeah.
All those things.
And they even recommend considering hypoadrenocorticism,
Right.
even if the electrolytes are normal.
Which is interesting, but it makes sense.
It does, yeah. Better to be safe than sorry.
Absolutely, especially with a condition that can be so tricky to diagnose.
Okay, so we've gone through all those initial steps.
Right.
But what happens if the diarrhea is still hanging around? despite all of those interventions.
Well, that's when things start to get really interesting.
Okay.
The chapter talks about dietary trials, which can be incredibly helpful,
Okay.
especially if you suspect food sensitivities or IBD.
Makes sense.
Yeah, and they recommend trying different types of diets, like hypoallergenic options or diets with added fiber,
Good.
and just seeing what works best for that individual pet.
Right. Finding what their gut likes.
Exactly.
Now, one thing that really caught my eye in this chapter was the discussion of antibiotic-responsive diarrhea.
ARD.
ARD, yeah, it sounds kind of counterintuitive.
It does a little bit, yeah.
Can you explain what that is?
Yeah, so ARD is basically a condition where dogs and cats respond really well to antibiotics,
Okay.
even though there's no clear evidence of a bacterial infection.
So it's like their gut just needs a reset or something.
That's a good way to put it, yeah.
It's fascinating. And they even recommend trying antibiotics, even if fecal cultures come back negative.
Which is interesting, right?
It is, yeah.
But it seems like it can be effective in some cases.
So it's not about targeting a specific bacteria.
No.
It's more about just restoring balance in the gut.
Exactly.
Okay, so after all of these steps,
Right.
if the diarrhea is still persisting,
Yeah.
the chapter finally addresses the elephant in the room, the biopsy dilemma.
Yes, the biopsy.
The biopsy, yeah.
And that's where things can get really tough,
Right.
both for us and for the pet owners,
Definitely.
because it's a big decision.
It is.
And the chapter really emphasizes that a biopsy should be a last resort.
Right. Not a first step.
Exactly.
Why is that?
Well, for one thing, it's an invasive procedure.
Right.
It comes with risks.
Right.
It comes with cost.
Of course.
And even if the biopsy does reveal IBD,
Yeah.
it doesn't necessarily mean you have to jump straight to immunosuppressive drugs.
You're right, because a lot of IBD cases actually respond well to less aggressive treatments,
Exactly.
like antibiotics, dietary changes.
Right.
So you really want to exhaust all those other options
Absolutely.
before you even consider a biopsy.
Yes, but of course there are situations where a biopsy is absolutely necessary
Right.
to get that definitive diagnosis and to guide your treatment decisions.
Like if you suspect something more serious,
Yeah,
like intestinal lymphoma,
right.
then you need that biopsy to confirm it.
Absolutely.
And even if IBD is the most likely diagnosis,
Mm-hmm.
the biopsy can help you determine the specific type of IBD
Right.
and how severe the inflammation is.
Which can then inform your treatment approach.
So it's not just about getting a yes or no answer.
Right.
It's about gathering as much information as possible to make those informed decisions.
Yes, and I think the chapter does a great job of emphasizing the importance of communication throughout this entire process.
Yeah.
Being really clear and open with the pet owners about what's going on.
Right, because this can be a long and frustrating journey.
For everyone involved.
Oh, sure.
So you really want to make sure those pet owners feel supported.
Absolutely.
And they understand what's happening.
Yeah, you have to take the time to explain everything.
Right.
The diagnostic process, the potential causes, the treatment options.
Right.
And you have to be honest about the limitations of our knowledge.
Absolutely.
We don't have all the answers,
We don't.
but we're committed to working with them to find the best possible solution for their pet.
It's about building that trust and partnership so they feel empowered throughout this whole process.
Right.
So sometimes, even with all of our knowledge and expertise,
Yeah,
the cause of chronic diarrhea remains elusive.
it does.
What do we do in those cases?
That's a great question. Well, it highlights the fact that sometimes we just don't have all the answers.
Right. Even with all the advances in veterinary medicine,
Exactly.
we don't have a magic solution for every problem.
So what do we do when we hit that wall? When we've run all the tests and we still don't know what's causing the diarrhea?
Yeah. Well, we don't give up.
Right.
There's still a lot we can do to help those patients.
And the chapter really drives that point home, right?
It does.
It's not always about finding a cure.
Right.
Sometimes it's about managing the symptoms
Exactly.
and improving the pet's quality of life as much as we can.
Quality of life is key.
So instead of focusing on completely eliminating the diarrhea,
Yeah.
maybe we shift our focus to reducing its frequency and severity?
Right. We might try different medications to control inflammation
Okay.
or slow down gut motility.
Uh-huh.
And we definitely want to make sure the pet is staying hydrated
Right.
and getting all the nutrients they need.
And what about dietary management? Does that still play a role in those cases where we can't pinpoint the cause?
Absolutely. Even without a specific diagnosis, we can often find diets that are easier on the gut and less likely to trigger diarrhea.
So things like hypoallergenic diets,
Yeah.
low-fat diets,
Uh-huh.
maybe even homemade diets with easily digestible ingredients.
Exactly. And sometimes just adding a little bit of fiber can help bulk up the stool
Right.
and reduce the frequency of those episodes.
Now, throughout this whole deep dive, there's one theme that just keeps coming up over and over again.
And what's that?
Communication.
Oh, absolutely.
It's so crucial,
It is.
especially when we're dealing with chronic cases,
Right.
because it can be so frustrating
It can be.
for everyone involved.
For the pet owners, for us.
Exactly.
So it's really important to take that time to explain everything.
Yeah.
Walk them through the diagnostic process, talk about the potential causes, the different treatment options, make sure they understand what's going on.
And be honest about the limitations of our knowledge.
Yeah, we don't have all the answers.
We don't, but we are committed to doing the best we can for their pet.
Exactly.
And I think when you approach it that way, you really build that trust and that partnership with the pet owner.
It's all about teamwork.
Yeah, so they feel empowered throughout this whole process.
Which can make a huge difference.
It can.
For everyone.
Okay, so to wrap up this deep dive,
Right.
I think the key takeaway for veterinary specialists like us
Yeah.
is that diagnosing and managing chronic diarrhea is tough,
It is. It's a challenge.
but it's also incredibly rewarding
It is.
when you can make a difference in that pet's life.
Absolutely.
It's like solving a puzzle.
It is. You got to put all the pieces together.
You do. You've got the history, the physical exam, the
The
diagnostics,
response to treatment.
the response to treatment. It's all part of the puzzle.
And sometimes you don't have all the pieces.
Right.
But you still have to do your best.
You do. And even when we can't find the underlying cause,
Yeah.
we can still provide supportive care,
Absolutely.
manage those symptoms,
Right.
and make that pet's life as comfortable as possible.
That's the goal.
And sometimes a little TLC goes a long way too.
Oh, absolutely. Never underestimate the power of a good belly rub.
Exactly. Well, on that note, I think we've covered a lot of ground today.
We have.
Thank you so much for joining me on this deep dive into the world of chronic diarrhea in dogs and cats.
It's been my pleasure.
And to all our listeners out there, thanks for tuning in.
And keep those tails wagging.
We'll see you next time.